Sounds a bit formal, doesn't it?
It does. But Sean did well. Thank you very much. Thanks for the chance to be here this afternoon. I do my very best never to say no to any opportunity to come and speak to audiences in the mental health field, because while what Bill said was absolutely right, that you can have conversations about things that you can do to promote good mental health with members of the public, it remains a conversation that people don't tend to easily or naturally. And so the opportunity to spend some time anywhere talking about mental health issues is something which I always value and am keen to take. Today's initiative, the Up For It Early Intervention Service, seems to me to have 4 key characteristics that make it important in itself and an important contribution to the wider work that we are trying to do in Wales in this area. First of all, it's innovative, and in really difficult times when there isn't money to do so many of the things that we really want to try and do, then making new things happen and making innovative things happen and making difficult things happen becomes by itself ever harder to achieve. So the fact that there is, a substantial sum of money from the lottery fund being used here in this part of Wales to try something new, to be deliberately experimental, to be prepared to take a few risks in a world where we are always, being driven to risk aversity, then I think as a characteristic, it's a tremendous thing to be able to celebrate today. Secondly, it is so very obviously cross-boundary in the way that it draws people from different sectors together to provide a service. And we talk about this a lot, and we see the common sense of it, and we know how difficult it can often be. Now, in Wales, we are rightly proud of the third sector contributions in the field of mental health and the whole range of organisations that as a Welsh Government we are very proud to be able to work with. And here Hafal has been at the leading edge of helping us to bring some learning from across our border that Hafal sister organisation has been involved in there, and to help us to apply some of that learning here in the Welsh context. But it isn't Hafal on its own, as you've heard. It's a firm partnership with Aneurin Bevan, so that the health service is not apart from but a part of the new work that will be going on, and then our partners in the local authorities as well. It's great to see people here this afternoon from different local authorities in Wales. I just wanted to pause for a moment, because there will be people in the audience who will have known Paul Oban, the planning manager for mental health services for Caerphilly County Borough Council, who sadly died last year, but who was very much part of those early discussions that went on with Hafal in championing the development of this project. And we know that as this project gathers strength, so other local authorities in the Aneurin Bevan area will become part of what is going on here. The third characteristic that I think you see here is in some ways a more challenging one, and part of the debate that Bill pointed to when he was speaking, because it's an early intervention project. And we speak very warmly and rightly of early intervention in our health services, investing, as the slogan goes, in trying to create the conditions of success, rather than having to spend large amounts of money in dealing with the consequences of failure. So much of our social welfare services in the United Kingdom have been modelled on that second way of doing it. You wait for something to go wrong, and often very expensively wrong, and then you wheel in a social welfare service, the health service, the social services, whatever it be, to try and pick up the pieces after the damage has been done, and that is both a very expensive but also quite often a very difficult way of trying to make any progress. So we are keen on early intervention for all the right reasons, but the actual history of early intervention is a much more checkered one. And in mental health, quite certainly, there have been examples over the years where we have tried to intervene early in people's lives with all the right motives, with every best intention, and have ended up making things better rather than making them, have ended up making them worse, rather than making them better. And that's particularly true in relation to services for young people, where in trying to do good, we end up instead drawing them into a system, labelling them, making that bit of their lives that is the difficult bit speak as though that was the only thing that was important about that young person and their life. So when I worked myself as a social worker and in the Youth Justice Service, I was a firm believer in maximum diversion and minimum intervention. Bill said we ask ourselves, and we are absolutely right to ask ourselves more than once when we are working with a young person, whether we ought to be drawing that person into the service that we provide. And he's absolutely right to say that. But I always used to fear, back in those days when we had a great deal of success in reducing the number of young people being drawn into the youth justice system and going into custody, that it was only half the story to say that we would divert them away from criminal justice, because the price of help, a criminal justice record, was definitely not a price worth paying. But simply to say go away to young people who often had very substantial needs without finding an alternative way of having those needs met, I think meant that we didn't complete the circle that was there for us to be completing. And I hope that that's what this service will be able to do. It will provide for the needs of young people early in a path, and at a point where that pathway could be altered, but it will do it without the damage that we know can flow from offering that help in a more formalised and service-driven sort of way. And that brings me in the way to my last key characteristic, which I think this service will help us to promote, because in the mental health measure and in the progressive legislation that we now have here in Wales in the mental health field, we have that high ambition of tackling not simply the illness or the condition of an individual, but the attachment of stigma in the whole field of mental ill health. And this is a service which really is based firmly on a recovery model, that sense that people who suffer from periods of mental ill health get better as well as getting worse, that the possibility of recovery is there, that we can accelerate patterns of remission, that we can prevent relapse, and that we can reinforce resilience in the lives not simply of young people themselves, but more broadly in the lives of those families, siblings, fathers, mothers, all those people who are also affected when something goes wrong in the life of an individual. And underneath all of that, but particularly importantly here, is that sense that young people are people in transition. They're not fixed. Their destinies are not fixed, their lives are not fixed, they are on the move. And for so many young people, they are lucky enough to have smooth transitions through their adolescence and into adulthood, often with an awful lot of paddling going on under the surface by families and other people to support them in doing that. And then there are other young people who, for all sorts of reasons, often compounded together in terms of poverty and disadvantage and other things that go wrong, where those transitions are fractured, where the gap between where you are today and where you would like to be in the future is so much harder to bridge, and where the work that this project will do in its innovative, in its difficult, in its challenging way is part of helping to rebuild that bridge between the lives of young people where they might be now and where they would like to be in the future. For all of those reasons, it's a great pleasure to be here today and to mark the start of a journey from which, as you've heard, there is a tremendous amount of interest far beyond Aneurin Bevan, wider in Wales, and where if we are able to crack some of these difficult nuts along the way, there will be some real learning which we will be able to take and make a difference far more widely. Diolch yn fawr iawn.